I want to talk to you a little bit about a new project we're working on. Essentially, this case involves treatment of women who underwent a laparoscopic hysterectomy and then ultimately ended up with very severe endometriosis or a really weird atypical cancer called parasitic myeloma. Most women who have undergone this treatment and suffered from this disease have absolutely no idea that it could have been caused by their hysterectomy. So the question is, how in the world can that be? The product that we're looking at is manufactured by a number of different manufacturers. Essentially what it is it is a tool used laparoscopically to remove the woman's uterus by clamping onto it, pulling it to the device, and then the device actually is kind of like a blender or a garbage disposal. And as it is pulled into the device basically chops up the tissue and then sucks it out of the woman's body. The doctor is able to do this by looking through another incision through a camera to see where that device is, and it actually works very well. The sales pitch for this type of device is that historically a hysterectomy for a woman involved a very large incision, a general anesthesia surgery that ultimately required the lady to remain in the hospital for a significant period of time. This is simpler, it is less invasive, and it decreases the woman's hospital stay substantially. So in theory, it sounds like a great idea. The problem with what they've termed the power morcellator is that despite the doctor's best efforts, when the tissue is pulled in and chopped up, not all of that tissue leaves the woman's body in the device. Despite all of the suction and design and doctor efforts and everything, you can't get all the tissue out. And some of the chopped up tissue remains inside the woman. The problem is that some of that tissue is problematic or can be problematic. There's a reason the woman's uterus is being removed. Typically in this case, it's because of uterine fibroids. So the morcellator leaves behind tissue from these fibroids, from the endometrium, and in a small percentage of women, there can be cancer or precancerous cells that are undiagnosed prior to the time of the hysterectomy. The morcellator can chop up some of these precancerous cells, and the precancerous cells remain inside the woman. In the old days, with the typical standard hysterectomy, those cells would not be chopped up and distributed. They would be taken out with the uterus, and the women would not develop problems. The second problem is sometimes there is inflammation of the endometrium, abnormal endometrial cells, and the power morcellator will chop those up and distribute those into the patient, and the patient can develop very, very, very serious endometriosis as a result of this, requiring surgical intervention, and it can result in extreme disability. So, is this something that we just figured out? Well, that actually is not true. In the scientific community, if you carefully study the literature, going all the way back to 1997, doctors started writing about the aftermath and consequences of using power morcellation technique to perform laparoscopic hysterectomies. First, they started talking about the endometriosis problem, and then they started talking about the cancer problem, leading to, fast forward 2014, the complete abandonment of the use of power morcellation technique. Typically, the patient that could be the victim of this problem is somebody who had a laparoscopic hysterectomy and then at some point thereafter, not even thinking you had cancer, developed an atypical cancer, or somebody that developed very, very serious endometriosis requiring additional surgeries and treatment and therapy. If that's something that happened to you, you actually might be a candidate for a case against the manufacturer of the power morcellator. There are a lot of cases that are filed. There will be more filed. It is a litigation that is just starting to gain traction and hold right now. But for those people that didn't even know they had cancer and ultimately developed cancer, especially after a power morcellation technique during hysterectomy, it could be a very, very good case.